All right. Good afternoon, everyone. My name is Pierre Binion, Senior HR Analyst for the City of Carson, and a company of Ms. Marcela Rodriguez, HR Specialist, both work for the HR and Risk Management Department. This is open enrollment for 2020 to cover 2021, of course. We're doing it via Zoom, pending COVID-19 social distancing rules. Today we have Mr. Alex Garcia from Blue Shield. He's going to speak about the various Blue Shield plans offered through CalPERS. And Mr. Garcia, whenever you're ready, you may start. Thank you. Mr. Garcia?
Hi, I'm here. I'm
Yeah.
sorry. I was
Okay.
speaking on mute. Thank you so much.
Well,
Welcome and thank you for joining this Blue Shield of California benefits presentation. Again, my name is Alex Garcia, and I'm very happy to be your presenter today. We know that you have many choices, and we appreciate you choosing Blue Shield of California. Now, what I'd like to do during our short time that we have together is to give you an overview of the Blue Shield benefits option through CalPERS. I'm going to talk about wellness resources that are available to you, and also cover some useful tools that are there to get you the care that you need when you need it. Now, what I'd like to do first is just share with you who we are. Now, at Blue Shield of California, we are a dedicated nonprofit organization with a focus on high quality health care at an affordable price. We are entirely mission driven, and we aim to transform the healthcare industry into one that's worthy of our friends and family. So Blue Shield has been a trusted healthcare organization in the communities that we serve, and we've also been offering health benefits to CalPERS employees for more than 18 years. And we strive to be a trusted advisor to help everyone here in California live healthy and fulfilling lives. Now, Blue Shield is offering two plan options to choose from. The first option is the Access Plus HMO, which is one that most are familiar with. This is our broadband network choice option that's available in 27 counties. Access Plus HMO gives members access to thousands of doctors and specialists in California, and it's been available to CalPERS employees since 2003. Your second option is the Trio HMO, which was introduced to CalPERS members this year in 2020. However, this has been Blue Shield's key and fastest growing HMO plan for the past 5 years. Now, Trio offers an exclusive provider network with a focus on high quality coordinated care while keeping your premiums low. With our Trio HMO plan, members have access to a select network of exclusive providers working more closely together. That's hospitals, doctors, Blue Shield, all committed to delivering you a better experience for you and your loved ones. Now, Access Plus HMO again, offers one of the largest networks of doctors, specialists, hospitals readily available to CalPERS employees. This means that you have the flexibility to seek care with zero to low co-payments for most covered services. In the Access Plus HMO plan, members do not have to worry about any deductibles, co-insurance, or claim forms after seeking services, which means that there are no surprise bills rendered by our in-network and service providers. And really, when you look at the numbers, you'll see that with Blue Shield's plan, it offers you both the flexibility, whether you choose Trio HMO or Access HMO, you can see how our members have a variety of options when it comes to finding a doctor or a hospital near your area. And our pharmacy network is available nationwide, and our members have the flexibility to access all major chains and small shop pharmacies. So both the Trio HMO and the Access HMO plan offers you support for your busy lifestyles. Now, to just talk a little bit more about the Trio HMO, members have the benefit of the in-demand doctor's visits, which are available every day of the year from 8 a.m. to 8 p.m. Now, HEAL is the option that you see on my screen. And during this visit, a licensed doctor will either come to your house, office, or hotel room. These on-demand house calls can assist you with a variety of cases, whether it's performing maybe a sports physical for your children to providing a flu shot. All is available at a very, very low copay. All Blue Shield members, whether you select the Access Plus HMO or the Trio HMO, have access to virtual doctor's visits through our Teladoc. This is the section over on the right side of your screen. Teladoc takes place either on the phone or a video chat. These are available every day, 24 hours a day. For Access HMO members, these telehealth visits are available at a low $5 copayment and no cost for our Trio members. Members also have access to this service when they're traveling. So if you're anywhere throughout the country, you can access this care for any non-emergency situations. Now, both the Trio HMO and the Access Plus HMO plan, you have access to our self-referral program. Now, traditionally, a standard HMO plan, you are required to obtain a referral from your primary care physician before seeking a specialist. However, for the Trio HMO and the Access Plus HMO, members can go directly to a specialist within their participating medical group with our self-referral program. And you can find out more about that by going into our CalPERS Blue Shield of California website. Now, our Shield Concierge team is a great resource to leverage this benefit. Shield Concierge is a CalPERS dedicated team made up of customer care representatives that can assist you with a variety of questions and work towards a seamless end-to-end resolution. Now, what this means to you is that you won't be transferred around, you won't be placed on hold for many minutes during your phone call. They will work with you throughout the way and ensure that you have no homework after the call, which is an added benefit. Now, Shield Concierge also includes other health professionals that can assist with our members, such as registered nurses, social workers, and health coaches. And our health coaches are available to support our members throughout the healthy lifestyle changes. And to access these services, all a member has to do is call the Shield Concierge number that's in the back of your ID card. So once you become a Blue Shield of California member, all you have to do is when you receive your card, the number in the back of the card will have this dedicated team to serve you. That's the Blue Shield Concierge line. Blue Shield support for our members is not limited to California, which is a common question about emergency. Our members have access to emergency and urgent care services around the world. And by registering with our Blue Card and Blue Shield Global Core program, you will only be responsible for your regular copay at the time of service, and you won't have to complete any claim forms upon your return. Additionally, Shield Concierge can provide you with a listing of contracted providers that are in the area that you're traveling to, which is a great service. And the last thing I'd like to cover is Wellvolution. Now, in addition to the various features that are included with our Blue Shield plans, we also have a proven wellness platform. Wellvolution is a Blue Shield clinical condition management program, which provides our registered members the access to all the applications that are available there within Wellvolution. Members, all they have to do is go onto the website, wellvolution.com, where you'll be asked a short questionnaire about your current habits and your future health goals. So whether you're looking to continue your already healthy habits or reverse an existing condition, Wellvolution has something for you. Again, members, all they have to do is go to the website. The website, again, is wellvolution.com. So we're kind of at the end of our presentation. I hope that you found this information valuable. What I'd like to do is just recap what we talked about. We talked about our commitment to our CalPERS members. Blue Shield has 2 great benefit options to choose from with our Access Plus HMO plan and our Trio HMO plan. And we also shared with you some virtual health features that enable you to get the care at the moment that you need it most. And then lastly, we talked about Wellvolution, which is there to help you to develop healthy habits. So if you'd like to find out more about this, and often that happens is that when we leave a presentation, we commonly forget, visit us on our website. Our website is blueshieldca.com/CalPERS. And I really want to thank you for giving me the opportunity to present to you today. Thank you.
Okay, thank you, Alex. I actually have a couple of questions for you.
Yeah.
So some of the common questions we received, especially we're talking about HMO plans and so forth. First of all, does the plan cover, let's say somebody needs to go do their eye exam, will it cover that?
It does. So let me do this for you. So the website that I was talking about is this one here. When you go into blueshieldofcalifornia.com/CalPERS, you're going to be taken to this page. Now, if you'd like to find more details about the plans and what our coverage is, you can go to our Blue Shield plan overview. When you click it, I'm just going to show you the different options that will answer a lot of your, benefit coverage and your copay responsibilities. So here under the Trio HMO, because we've got 2 options, you would have then 2 benefit summaries. What I'm going to do is to answer your question, I'm going to go to the first one, is I'm going to go to the Trio HMO open enrollment brochure. And what it's going to do is it's going to open this brochure, which I really like because it's very comprehensive. And then you'll see here what your copay responsibility is for many services. So for example, here, you asked for examinations. And I'm going to quickly just do it. Let's search here. So here under vision care, you'll see that eye refraction to determine the need for corrective lenses is a no-charge service. Eyeglasses not covered except for those that are necessary after cataract surgery, you get a 20% discount. But generally here, your eye refraction examination is covered at no charge. Now, when we go to now the Access Plus plan, and again, seeking the open enrollment brochure, it's going to open up a different brochure, very similar to the one that we just looked at. And then we're going to go and search for, again, Vision Care. And it looks like it's the same benefit plan in terms of the coverage for that service. So eye refraction is a no charge responsibility for that exam. Does that answer the question?
Yes. That answers the question. Thank you a lot. Now, regarding willingness, does the plan offer credit for somebody who's taking active steps to maintain a healthy lifestyle, like going to the gym, free counseling, free training, anything of such nature?
Yes, so then that would be under our wellness program. And again, I'm going to refer you back to the microsite. So we'll go in here so that you can see for yourself what is available. And here is the type of wellness programs that we have available. So I talked about it kind of towards the end of the presentation. This is the Wellvolution program. And we have programs there such as these: reverse disease, eat better, exercise, manage stress, etc. Now, if we click the Learn More button, it's going to give you the personalized support that you can access. So say you're looking to lose weight, you can click on this link and it'll direct you to a new page that will focus on exercise and eating better. Now, we also have other programs available. Now, we've got these apps that are here, all designed to keep you healthy. So we have one that's on effortless weight loss, better health. This is the application. And then there's a description of what is covered. Then you have the Digby Health, which is focused on DNA and gut biome testing. So it's a program that's really focused on looking at your DNA structure, and it also includes an at-home test kit that you can take in order to personalize a diet for you based on your DNA. Then we have other coaching as well. So if you're looking for one-on-one coaching and personal support, here is another app that's designed for that. All you'd have to do is, with all these programs, just sign up, and you'll be on your way to accessing all the benefits for each one of these programs. Then we have, this is really a program that's really kind of like a Fitbit tracker, so it manages your activities throughout the day. Then we have Monjwell, again, personal coaching with a focus on meals and how to design meals. And we have Plate Joy, which is, again, meal planning, working with the scale and how to shop for groceries online. And we can go on for so much more, but we have so many programs here, as you'll see me scrolling down. So take advantage of all of that. It's all available to you, and it's easily accessible. If you want to see a short video, again, it's actually here on the same website. You can see what's available, and you can find more detail as you start to kind of really dig deep into all the tools that are available as a Blue Shield member.
Right. Thank you, Alex. A couple more questions. Are regular flu shots covered through the program?
Yes, they are. So I'll tell you what the copay is. So this would be generally under immunization. So I'm going to show you here. This is the Access Plus, and I'm just going to highlight with my mouse. and you see here that immunizations are covered at a no charge copay. So this is Access Plus. I'm going to show you on the screen also for the Trio HMO, no charge.
Okay. My last question to you is regarding the COVID-19. What is being covered by the plan regarding COVID-19 testing, taking care? What happens if somebody who has a plan needs to go into intensive care, or a member of their family needs to go through intensive care? What are the services offered by Blue Shield for such participants?
Yeah, on both plans, you have the coverage to treat you for any illness, regardless of COVID-19 or another illness. So you have the benefit that's going to take care of you in that situation. So you don't have to worry about there being a pre-existing clause. There are no pre-existing conditions on either plan. So you have the reliability that if you need to go in to see a doctor or get hospitalized, your HMO plan is going to cover you. So just to take a look really quickly on what that benefit is. So if we're looking here at Trio HMO, you'll see here that your hospital inpatient services are covered, no charge. If there happens to be an emergency situation and you need to you go through emergency room, you have a $50 copayment. However, if you're hospitalized, that $50 copayment is waived, and it falls under the no charge service under the hospital care. Now, going back to the Access Plus, you'll see here that you have the same benefit here. You have no charge for hospitalization, no charge for outpatient care. You have outpatient surgery care, and again, the same benefit for emergency services, $50 waived if you're admitted into the hospital.
Okay, I did receive one question for somebody. I mean, after what you went through, what is the difference really between the two plans offered by them? Like, why would one person choose one over the other?
Yeah. So I'm gonna explain it in more simple terms. So you have the Access Plus program that is a really broad network of doctors. So no matter where you are in California, you're going to find a Blue Shield physician that's going to be able to treat you. Now, with the Trio HMO, you have more of a network of local doctors, hospitals, and medical groups working together in a coordinated care, making sure that you stay healthy. The focus really here is broad network versus local doctors and medical centers. So before you join the Trio HMO, what I would recommend is that our members go into the website and check if there is a network of Trio HMO physicians, and this is where I'm going to direct everyone on this page. So this would be the main page. You go under Trio HMO, and you'll see here provider videos, and under here you see provider network list. So this is Los Angeles area. You'll see here that we have a very robust network of medical groups and hospitals over on the right-hand side of the column, all working together to provide the care. So again, you have this smaller but robust area of network doctors under the Trio plan, all communicating with each other. And then you have the Access Plus HMO, which is a broad network of providers. The difference here in terms of impact to our members is that you will see it in the premium. The premium for the Trio HMO plan is a lot lower than it is on the Access Plus, because with the Access Plus, again, you're paying for that broad network of physicians. I hope that I was able to explain that in easy terms for you, for it to be understood. Do you have any questions?
No, I'm done with all my questions. Any, Gursal, do we have any questions?
Can I ask a question?
Of course, please do.
Yeah, so I have Blue Shield, HMO, the Access Plus, and so we had healthcare partners. I had healthcare partners, but I think they were taken over by Optum. And so I want to know, is it the same? Is it just a new name, or are all the services under Optum the same as they were under Healthcare Partners? And the same doctors,
Yeah.
same everything?
Yeah. They are. So no change in terms of how you're getting your care. If you'd like, let's do this. Let's go and switch gears over from Trio to the Access Plus plan. And we're going to click on the provider list. And we'll search for Optum here.
Yes.
So there it is. We have Alhambra, Arcadia, Burbank, LA, East LA, and so on.
Uh-huh. So is there still a Healthcare Partners, or Healthcare Partners is no longer Healthcare Partners, it's Optum now?
It's Optum now.
Okay. So the only thing that's changed is the name.
Yes.
Okay. Great. I called a specialist office today, and she says, oh, we take Healthcare Partners. And I said, well, it's Optum now, so I don't know if all of the specialists or all of the offices know that. I would think they would know.
Yeah, it's always tricky when medical centers are in a transition. If you have any doubts about a particular doctor, call our concierge line, and they'll be able to give you more of a broader search for you.
Okay.
And that's if you care not to go into the website. You can also do that here under Find a Doctor. I don't know if you can see that on my screen.
Yes.
If you click on this section here, you'll be able to search a specific doctor within a medical center, or you can search the doctor by name or specialty.
Okay. All right.
But,
Thank you.
Oh, you're so welcome.
You were going to say something else? It sounded like you were going to say.
I was just going to direct you to the phone number just in case you didn't know where to find it. The number is also in the back of your ID card, but you'll see it right here as I'm highlighting it with my mouse. The line is Shield Concierge.
Okay, thank you.
You're welcome. Any other questions?
I don't have any other questions. Gursal, do we have any other questions?
No, I don't have any questions.
Okay.
Okay.
Well, here are the key dates. So open enrollment started this week. So on this page, you'll see those reminders to make sure to take care of your choices for open enrollment. There is nothing really to do this year other than make sure that you are happy with the selection that you have. If you are, still, it's always a good idea to just check to see if there's anything different that you want to, look into with your other care options. But in terms of enrollment for Blue Shield, again, you have the two options to look at. You've got the Trio HMO plan. Key here is the lower rates, and you have access to local doctors. You also have the Access Plus plan, which is a broad network of doctors that are available throughout the state of California. So both plans are great plans. You have the emergency service coverage, you have hospital care coverage. We went over the brochures on what the responsibilities are in terms of care. So you'll see here that both are very robust benefit options. The only other thing that I would encourage everyone to do is just make sure that you have access to a website. If you want to, go back here and relook at all the benefits and features that we have available. We've got some quick links over to the left-hand side. So if you forget kind of how I went through each one, you can get there faster by either clicking home, find a doctor, the plan overview, what your pharmacy benefits are, and other programs available to you. So, and if you'd like to hear a presentation also, you can watch a video and it'll launch into YouTube and you'll be able to see the presentation that I just went over today.
Okay, well, Alex, we thank you on behalf of the city of Carson for coming in today and giving us this wonderful information and presentation. For everyone who's going to be watching the video or anyone present, you can always contact the Blue Shield concierge, the number listed on the website. You can always also contact our own HR department here, and our personnel are available to assist you as much as we can. Open enrollment is currently active and it will end around October 16. We ask everyone to please not wait to the last day because, after all, there's occasionally technical issues with CalPERS and other such items, so we always want to give room for making sure that everything is correct. Alex, again, thank you on behalf of the city and the HR Risk Management Department. It was a wonderful presentation and we obtained a lot of valuable information. Okay, for everyone in the meeting today, we're going to head right now and end the meeting. Have a wonderful day. Bye.
Thank you. Bye-bye.
Bye.